Ageism has an enormous impact on people's experience with the public health system. It ranges everything from making it difficult to recruit students into fields where there'll be professionals supporting older people. It changes people's beliefs about what's possible for themselves or their older relatives. And finally, it has enormous impact on public policy. When society is experiencing a high level of ageism, it's hard to fund services and supports for older people properly. Unfortunately, health and social care systems are tinged with ageism. And we can see this when we look beneath the surface. What you find is that often these services and the buildings and the professionals involved adopt an idea that aging is all about decline. And when you start with that framework, you get systems and programs that actually reinforce decline. And I'm in favor of a reorientation of the sector away from decline and toward human development and growth. And we've really seen this in social sector supports for young children. Everybody agrees that young children are the future and that they can grow. And we actually need the same sort of revolution in thinking in the field of aging as well.
One of the biggest issues that we face is people thinking of older people as them, not us. So when we design things, we don't think about what we actually want or how we want to live. We design things that are going to be good for people. We can do things for you and to you, and we know best. And it's extremely patriarchal and it's really patronising. One of the things that we found is when you've met one older person, one 80-year-old, you've only met one 80-year-old. Yet in the health and social care system, we lump everybody in together and design one size fits all. And quite frankly, you wouldn't do that any other age group. So to put an age on anything is limiting our view of people. It's limiting our view of our life. And what we need to get back to is understanding everybody's desires and aspirations at whatever age they're at. One of the really big challenges for commissioners, particularly in a time of austerity, is how do you make the pound stretch further? So their solution so far has been to reduce the accessibility to services. What we're saying is actually if you ask people what they're prepared to pay for, then you'll have more options, more choices and more ability to create and design new models of support. People never want to buy care. Care is about showing your vulnerability. Commissioners are still in that framework of I have to provide these services to this group of people. But actually the vast majority of us are not going to be covered by those commissioners. So it seems really strange that the market is designed and determined by a few commissioners looking after a few people when the vast majority of us are going to have to pay for our care and want to have something different.
When we wrestle with these issues, we're really talking about what we want, not what's best for them. So whether they're professional organizations or governments or local people living in the community, I always want to emphasize that aging is about everybody. That aging is one of those things that actually unites us in our experience. So instead of talking about older people as an alien species, I like to really reinforce the idea that I'm talking about us.